Hello friends, how are you? This is Dr. Sri Nagi, Ayurveda and Medicine Doctor and also Isha Hatha Yoga teacher. So today in this video I am going to talk about tongue examination. In Ayurveda, Ayurveda doctors are examining patients by looking at their tongue. You must have seen many Ayurveda doctors. If you go and you talk with some Ayurveda doctor, they always ask you like, can you take out your tongue? So, many times patients think like why they are asking to take out tongue. So, today I will tell you certain things about tongue examination. Just by knowing these things, you can evaluate your tongue to some extent by yourself. You must be thinking if tongue examination is the only science that Ayurveda follow. No, in homeopathy also doctors examine your tongue. And in allopathy also, that is Western medicine, doctors clinically examine your tongue and recognize few things. So, about Western medicine and homeopathy I will not talk today. So, as I am an Ayurveda doctor, so I will talk about only the Ayurveda aspect of tongue examination. In Ayurveda, tongue examination is known as Jibha Pariksha. Jibha means tongue. Jibha is the Sanskrit word for tongue and Pariksha means examination. How to evaluate certain signs and symptoms in tongue to figure out how the health of our internal organs is, especially the organs that are related to digestive system. So, let us see what Ayurveda has to say about it, or let us see what your tongue has to speak about your health. As you know, in ancient era there were no ultrasounds, there were no these latest techniques to evaluate the internal organs of a person. There are just signs and symptoms which doctors observe, and on that basis they prescribe medicine and patients get well. So, this science is a very deep science to observe and to see things, and you need a very keen observation to see certain things. Though everything what a Ayurveda doctor think by looking at your tongue, the good thing about tongue examination is you can do it by yourself. So, how you can do tongue examination? Let us learn. So, first the foremost thing to examine tongue, never examine tongue in some lamplight or inside the room or in some kind of dark room or in among some yellow lights or something. Like you should always examine tongue in outdoors, that is in sunlight. This is the first and foremost principle if you want to do Ayurveda tongue examination. You need to examine tongue in sunlight, not under some bulb or with torch, not like this. Tongue is best to examine once you take shower, you clean your teeth, you do your practices, you do your yoga if somebody is doing. Either you examine your tongue at that time, or if not, then 1.5 hours or 2 hours of after food, then also you can examine tongue. But the moment you are going to examine tongue, make sure like if you have eaten anything oily or anything coloring like turmeric or anything, you brush up your teeth, you clean your tongue, and then you go for tongue examination. You must be thinking how I can examine my tongue by myself. So, you can make use of mirror, small mirror, you go in sun and you take out your tongue and examine your tongue in mirror. Though Ayurveda doctors have various signs and symptoms that they need to see, but there are certain symptoms which are very general, which even patient can see and anybody can see who is conscious about their health. So, I am going to talk about only those symptoms today, not like full detailed Ayurveda diagnosis I am not going to tell because it is very confusing, because it will be very confusing for a person. But there are certain things which are very obvious and everybody can see and make use of it for the benefit of their health. So, first and foremost thing, if your tongue when you take it out, you feel like it is very faded or pale, or you can say it does not look reddish, it looks very like there is no blood in the tongue, you know. like no reddishness in the tongue, though it looks very purplish, very the color of the tongue is not reddish, in reddish tinge, it is more of purplish and very, like it feels like there is no blood in it, it's more towards the darker side. That means there is a possibility that you have anemia or Rakt Alpata, that is the terminology we use in Ayurveda for anemia. So, is it sure shortly thing, like if like this is there, you must have anemia? For sure diagnosis, you need to visit some clinic or some Ayurveda doctor. That is one thing, but at least it will give you a signboard, like whether you need blood test or you don't need blood test, whether you have anemia or you don't have anemia. But if you have this kind of tongue, like you take out your tongue and just like this, no, take it out and then see if it is very pale or it has like a very less reddish thing, then maybe it is because of lack of blood. So, it is not every day you need to go and check for your tongue, oh today blood is there or not. Once in a month, once in a 2 months you can do this examination. It will give you clear indication whether there can be anemia or there can't be. And if there is anemia, there will be other signs and symptoms associated with it, like you feel very fatigued, you will be tired very easily, your sleep will be disturbed. There are other symptoms that are associated with it, but at least it is one thing that you can make out just by looking at your tongue. Next thing is, if your tongue is when you take out and you feel like your tongue has more of blue color, the color of your tongue is not reddish, is not pale, it is more of blue tinge. So, that means your oxygen level in your tongue, not in tongue, actually whole body, the oxygen carrying capacity of your blood is less, or there is lack of oxygen in your system. Especially certain diseases like COPD, chronic obstructive bronchial lung disease, in these cases, or some bronchitis or some chest infections or some cardiac problems, this kind of tinge, that bluish tinge in the tongue happens. Sometimes these symptoms are not there, but hereditarily your tongue is blue, and your father's is blue, mother's is blue, and like this. So, there are exceptions also, but at least this also, if you see bluish color, earlier it was proper reddish, but now if you are seeing it is more of bluish tinge in the tongue, that indicates maybe there is some kind of oxygen deficiency in the blood. So, what you can do for that, not go and just breathing oxygen, you do more and more of yoga, more and more of meditation and pranayama, that will enhance the lung capacity, and this bluish tinge will naturally go away. You need not be scared, oh my God, blue happened. No, you need not to be get scared, but at least it is one of the thing, like this bluish color, if it is happening in the tongue, this indicates there is a lack of oxygen in the system. So, you focus on your yoga, pranayama and meditation and relieve stress from the system, so that your more and more oxygen can enter in your blood. Go for a walk in a park or do yoga in somewhere where there is more oxygen, more plants, and you will see with eventually within 15-16 days of time it will become better.